name is Richard Harding, and I'm a general surgeon in Phoenix, Arizona. I am originally from Washington, D.C., and did my general surgery training at Georgetown University before moving to Phoenix. Since working in Phoenix, I've been working with broad-range general surgery and then developed more of a focus on endocrine surgery over the last 20 years, where I've been focusing on surgeries of the thyroid, parathyroid, and adrenal glands, in addition to minimally invasive surgery as well as robotic surgery. Thyroid surgery can be done either open or it can be done now with radiofrequency ablation, which is actually applying a probe into the neck and applying an energy with this probe. And the radiofrequency ablation involves applying an energy, which is a high frequency current, to the tissue right at the end of the needle, which then heats up the tissue and destroys the immediate tissue adjacent to the needle probe. And with thyroid surgery or thyroid radiofrequency ablation, we can apply this probe directly into the tissue and specifically identify exactly the area that we are treating, such that the area can be destroyed without destroying the entire thyroid gland. Patients who have large thyroid nodules, particularly nodules which are visible or are causing compression symptoms such as choking, difficulty with swallowing, even patients with a chronic cough, or patients who have a constant sensation of something stuck in their throat. Those patients will benefit by radiofrequency ablation as long as the thyroid nodule itself is proven to be benign, which means that we need 2 biopsies proving that the nodules are not going to cause any future harm to the patient. There's another subset of patients also who have a nodule which is hyperfunctioning, which means that they are producing far too much thyroid hormone, and this ablation therapy will destroy that nodule and then resume the normal function of the thyroid gland quickly thereafter, and so that those patients no longer require medications to control or suppress the thyroid function. So that's been an exciting advance for these patients. Patients who have surgery will have not only an incision on their neck, but will have some general soreness and stiffness in the neck, and they are required after surgery to limit their activities for several days before they can resume normal lifting, normal activity. Whereas with radiofrequency ablation, really you can resume their normal activity the next day. And we're not talking about extreme exertion, but significant activities such as hiking and walking and doing usual household activities. The patients who have surgery have to spend essentially the whole day checking into the hospital, undergoing the surgery, recovering from anesthesia, and then going home and recovering from more anesthesia before they or even start their recovery. Whereas by the next day, patients who have undergone radiofrequency ablation, they've actually stopped taking their Tylenol by the time they see me by the next day. So the change or the difference in the recovery is dramatic. Patients who undergo this procedure, number one, retain the function of their thyroid gland, which is the driving force for the procedure, in addition to avoiding an operation. They can have the entire thyroid gland, the entire thyroid nodule treated and destroyed, and retain the function of the thyroid gland on that side, and it's done under local anesthesia. So the recovery is minimal, and the ability to follow these patients is not changed, and it doesn't burn any bridges, so that they don't need a thyroid tablet every day, and they truly retain the normal function of the thyroid. My patients have been delighted with this procedure. For one thing, it's done as an in-office procedure, which is very easy for them to access. They are done under local anesthesia. They feel the results by the next day. They see the results within a week or two, and then they notice that the thyroid continues to shrink over the first month and then on to the next 6 to 8 months, such that the nodules essentially disappear to their eye. And they state they feel better, the compressive symptoms go away very quickly, and they really have no surgical pain other than general soreness for a couple days. So they've been truly delighted with this procedure.